We're going deep today, diving into something I bet you've never really thought twice about. Inhalers.
Oh, yeah.
You use them, you put them away. But the science of how that medicine actually gets from the device into your lungs?
Yeah.
Well, that's what we're talking about today. Aerosol drug therapy.
Right.
And no, it's not just for asthma anymore, right?
Right.
We've got some research here that suggests this could revolutionize how we treat all kinds of things.
Yeah.
Diabetes, even cancer. So let's back up for a second. What is an aerosol? I mean, I think hairspray, right?
Sure.
But what are we talking about really when it comes to using them in medicine?
Yeah, I mean, it's more common than you think. An aerosol is basically just a bunch of tiny solid or liquid particles that are suspended in a gas.
Uh-huh.
Think smoke, mist, fog,
Yeah.
Aerosol therapy just takes that simple idea and uses it to deliver medicine directly to your lungs.
So why not just, swallow a pill? What's the advantage?
Well, that's what's so cool about it is you get a much higher concentration of the drug right where you need it instead of having it go through your whole system.
Right, and fewer side effects.
Right, exactly. Fewer side effects.
Which everybody wants.
Yeah.
Okay, so how does it actually, though, I mean, we've got the medicine in this aerosol form. How does it actually get from the inhaler to your lungs?
Well, think of it like a little journey, and there's a couple of checkpoints along the way.
Yeah, okay.
First, you've got the output. So how much drug is actually released when you use the device?
Okay.
And then you have to think about the particle size.
Particle size.
Yeah.
Why does size matter? It's microscopic.
It is microscopic, but size is everything when it comes to this type of therapy. Different parts of your respiratory system are better at trapping different size particles.
Okay.
It's kind of like if you threw a tennis ball at a screen door, it would bounce off.
Right.
But a tiny grain of sand could go right through.
Makes sense.
So it's about getting those particles to the right spot.
So not just getting it in there, but getting it to the right place.
Exactly. And that's where this idea of deposition comes in. Yeah, deposition,
right.
Where those particles actually land within the airways.
So we've got these different particles making their way through. What's deciding where they're going to end up?
There are three main mechanisms, and they're all related to physics, really.
Okay, hit me.
First, you have something called inertial impaction. Remember the tennis ball and the screen door?
Yeah.
Same idea.
Okay.
The larger the particle, the more momentum it has.
Right.
So when you breathe in, those large particles are much more likely to just slam into the walls of your upper airways and stay there.
Right. Like those carnival games, if you're trying to get it in the thing.
Exactly.
Aim, velocity.
Okay. Then you have sedimentation.
Okay.
This one's all about gravity.
Okay.
The heavier particles are going to settle faster.
Right.
So the longer you can hold your breath after you inhale, the more time they have to settle deeper down into your lungs.
Okay, so the breath holding thing, very important.
Yes.
What about the small particles? What gets them down into those little tiny airways?
Well, that's where Brownian motion comes in.
Brownian motion.
Brownian motion.
Okay.
Think about like a snow globe. You shake it up, and those little particles just go everywhere.
Yeah.
In your lungs, that random movement helps those tiny particles to reach even those small air sacs.
Okay, so it's like a combination of momentum, gravity, and a little chaos theory.
Yeah, pretty much.
To get it where it needs to go. And now I'm realizing how much I've been doing it wrong.
Well, that's why it's so important to talk to your doctor.
Right.
They can help you get the technique down and the right device because there are a bunch of different devices.
There are. I always thought an inhaler was an inhaler.
Oh, no. There's a whole bunch. We can get into that, though.
Okay. So many different devices. Okay, let's talk inhalers then. So like I said, I thought it was one size fits all, but you're saying there's a lot of variety out there.
There is, yeah. Because it's all about getting the right dose of the medicine to the right part of your lungs, and that can depend on a lot of things.
Okay.
What type of medication it is. Right. The patient's age, how well their lungs work, Yeah. All that comes into play.
What are the most common types then?
Probably the one you're most familiar with is called the metered dose inhaler.
Okay.
MDI,
Ah, okay.
It's that little canister.
Right.
Often has a little plastic mouthpiece. That's the kind that releases like a measured puff of the medication.
Yeah, like the ones you see in first aid kits and stuff.
Exactly, yeah. And they're popular for a reason. They're convenient, they're pretty cheap, and they deliver the medicine quickly. But they do take a little bit of technique to use, right?
There's a technique.
There is.
Yeah, so.
Timing is key. You got to press down on the canister, inhale slowly and deeply all at the same time.
Okay.
Otherwise, the medicine's just going to end up in your mouth and your throat. It's not going to go where it needs to go.
So that's what those spacers are for.
Yeah. The spacers or the holding chambers that you see. Yeah. Those are great, especially for like younger kids, older people, anybody who has a little trouble coordinating everything.
Right.
Because it gives you that little extra space to get it all in.
Right. And then what about those dry powder inhalers?
Yes. Dry powder inhalers, those are the DPIs.
DPIs.
They work a little differently.
Okay.
They don't have the propellant, like the MDIs.
Okay.
It's your breath that pulls in the powdered medication.
Oh, interesting. So you're making the aerosol yourself.
You got it, yeah.
Okay.
And because they're breath activated, you don't have to worry about coordinating your breathing with like pressing down on the canister, which is nice for some people.
Okay, so it's a little less complicated that way.
Yeah.
Any downsides to them?
Well, one thing is you do have to breathe in with a little more force than you do with an MDI, so that can be tricky for, little kids.
Yeah.
People who have weaker lungs and they have to stay dry, that powder, if it gets wet, you're in trouble.
So you said before that not every medication can be delivered with every type of inhaler.
Right.
What about people who have something where they need like a higher dose of medicine or they need it more continuously?
Well, that's where nebulizers come in.
Nebulizers.
They're not as portable, you're going to carry it around in your purse or your pocket or whatever, but they are great for delivering those bigger doses or if you need the therapy continuously for a longer period of time.
So that's like the big guns of the inhaler world, the nebulizer.
Yeah, you could say that.
How do they work?
Basically, it takes the liquid medicine and it turns it into a mist.
Okay.
That you breathe in, usually through a mask or a mouthpiece. And there are different types, of course, but they all kind of work the same way.
This is blowing my mind.
Yeah.
So much variety. I had no idea. So I'm guessing choosing the right one, you've really got to have that conversation with your doctor.
Oh, absolutely.
To figure out what's best for you.
Definitely, yeah.
Okay. So we talked about how aerosols work, how the little particles get there, the different devices, but nothing's perfect. What about the risks? Are there risks to using aerosol therapy?
Yeah, that's an important question because while it is generally very safe and it's effective, there are some things to keep in mind.
Okay, well, let's talk about them. What do people need to know?
Well, one thing, especially with some of the nebulizers, is the risk of infection.
Infection.
Yeah. Think about it. You're creating this warm, moist environment right in your airways.
Right.
Perfect breeding ground for bacteria.
If you're not cleaning it.
Exactly. Yeah. So hygiene is super important.
Okay. What about the actual medicine?
Sure.
Any risks with taking it in aerosol form?
There can be. Some people experience something called airway reactivity. Basically, the cold aerosol itself or some medicines, they can bother the airways.
Okay.
Trigger a bronchospasm.
So like when you go outside on a cold day and you breathe in and your chest tightens up?
Yeah, exactly. Like that. It's not uncommon, but your doctor might give you like a bronchodilator to take before or with your other inhaled medicine to kind of open those airways up.
Good to know. Good to know.
Yeah.
Any other downsides that we should mention?
Well, even though, this therapy is designed to target the lungs directly.
Right.
There is a slight chance of some what we call systemic effects.
Systemic meaning?
Meaning a tiny bit of it could get into your bloodstream.
Right.
It's usually not a big deal, but it is something to keep in mind, especially if you're on other medications.
Right. Right. So basically talk to your doctor.
Yeah.
If anything weird is going on,
Always a good idea.
So we've talked about the present, the science, the types, the risks. But what about the future? What's coming up next with aerosol therapy?
This is what's so cool about it.
Yeah.
I mean, we are really just getting started.
We've talked about the present, the science, the types, the risks. But what about the future? What's coming up next with aerosol therapy?
That's what's so exciting. We're really just scratching the surface of what we can do with it,
Right.
We're not just talking about treating lung conditions anymore.
Oh, okay. Like what else could we use it for?
Imagine if instead of having to take painful injections or swallow a bunch of pills, you could treat things like diabetes, even cancer.
Wow.
With just an inhaler. That's the kind of potential we're talking about here.
That sounds like science fiction. How would that even work?
Researchers are looking at ways to basically package the medications into these tiny, tiny particles that you can inhale.
Right.
And your lungs are already really good at absorbing medication into the bloodstream.
So you're saying this could be like a faster, more efficient way to deliver all kinds of medication.
Exactly. And because you're targeting it,
Yeah.
you don't need to use as high of a dose.
Right. Which means fewer side effects.
Right. Are there any concrete examples of how this is being used or how it could be used? Absolutely. One area that's really promising is cancer treatment.
Okay.
Imagine being able to deliver chemo drugs directly to a tumor in the lung
Wow.
without harming the rest of the body as much.
Right.
They're even looking at ways to deliver insulin this way for diabetes.
Wow.
So no more daily injections, you know?
It makes you think, what else is out there that we just haven't?
It's amazing, isn't it?
Yeah.
We started with something as simple as an inhaler, and now look where we are.
It really is incredible when you think about it.
The power of science and a little bit of curiosity, you know?
That's right. Well, on that note, I think we'll wrap things up here. This has been a fascinating deep dive into the world of aerosol therapy.
It really has.
And like we always say, the next time you use your inhaler,
Yeah.
think about that journey.
Mm-hmm.
All that science, all those little particles making their way.
It's pretty amazing, yeah.
It really is. And who knows what the future holds. It's going to be exciting to see what's next. Until next time, happy deep diving, everybody.